Hey everybody, welcome back everybody. This is John Malanca from the Association of Cannabinoid Specialists. I'm here with our leader and founder, Jordan Tishler, MD, also Dr. Jordan Tishler, as well as Suzanne Mulvehill. Suzanne is an MBA, BSW, board certified clinical sexologist, as well as a female orgasmic disorder specialist, as well as a PhD. And are you still located down in Florida, Miami, Florida?
I am in Florida. I'm in Italy right now, but that's my home is in Florida. Yes.
Even better, even better. So welcome and good evening and or good night. What time are we for? 9
It's at
p.m.
night here. Yeah.
Yeah. So good to see you.
Thank you.
The topic today, we've covered a lot of topics and at the Association of Cannabinoid Specialists, and we love your feedback. And the feedback for this actual podcast was cannabis being a therapeutic for female orgasmic disorder. Dr. Mulvehill is a specialist, and that's why we brought her on. So thanks for being with us today,
Thank you for inviting me.
Doctor. So the
Thank you
question
for
that
inviting
comes
me.
up is, can therapeutic cannabis help women who have difficulty orgasming or never had an orgasm? And so there is some anecdotal research clearly saying yes. And I'd love to hear your thoughts about this as well, because it is a topic that comes up. And it's a lot, the stigma one of cannabis is starting to drop, but also as Americans, people don't really want to come out and talk about their personal issues, even when it comes to orgasms or sex. And so, thanks for leading the pack, both you and Dr. Tishler, because you both have done this for quite some time. And so, welcome. And what can you add to that?
Thank you. Well, having just conducted a research project for 4 years for my dissertation, and I really have to say Dr. Tischler was my dissertation advisor,
Good.
very much involved in every aspect of my dissertation and research. Our study was the first one that dichotomized women with and without orgasm difficulty during partnered sex, with 52% of the women saying that they had difficulty orgasming during partnered sex. And I guess the results really, that's really where the rubber meets the road per se. But when we really saw that the statistical significance for cannabis improving orgasm frequency, ease, and satisfaction, we using the FSFI, which is called the Female Sexual Function Index,
Mhm.
orgasm subscale questions that measured frequency, ease, and satisfaction. And the results were statistically significant that cannabis improved orgasm frequency, orgasm ease, and orgasm satisfaction for women with orgasm difficulty and all women in the study. So, Dr. Tischler, if you want to add
Well, I
on.
mean, so that's a great synopsis. I think I would only add that, what we've seen through the literature as well as women's reports is that difficulty achieving orgasm or satisfactory orgasm is a huge issue for many women. And in our study, that turned out to be over 50% of them. And that through the use of cannabis, what we found was roughly 72% improvement in those three parameters that Dr. Mulvehill just mentioned. And I wanted to mention that degree of improvement because number one, compared to a conventional therapeutic, where we consider sort of a 40 to 45% improvement to be a grand slam, this is certainly more successful. And we don't have any conventional medications that really do any of these things, right? Just backing up a second, we know that sexuality is a huge issue for many people across all genders, right? And that there are a bunch of different ways that we kind of sort of academically look at the process of sex to try and understand it. And what we've sort of come to understand is that there are sort of four domains, right? So there's desire, libido, right? And then there's arousal, right? Which in females equates to lubrication and other phenomena that go along with that. And in men, erections. And then we have orgasm, right? And lastly, we have satisfaction. And so problems can sort of arise in any of those areas. The area that we focused on is orgasm specifically in females, but it's important for us to remember that across genders, problems can arise in any of those domains, sort of at any time, and that there are a huge number of people who have difficulties in those various domains across their lifetime. And this isn't limited to women, certainly not limited to men. And really, other than those few drugs that we have for male erectile dysfunction, we got bupkis for any of these other people or any of these other problems. So to be able to say, look, we now have a medication in cannabis that can dramatically affect the outcome for women in this particular problem is a real game changer, because there isn't anything else. And I think that's part of what's made this important and very satisfying as research.
So are you seeing both this? One of my best friends, and I won't name her name on camera, of course, from high school. She's had this issue, and her mother had this issue, and it's now she's 57 and married, and I don't know, something changed. I had this discussion with her probably about 3 months ago, and she says, where she's able to orgasm. She's done everything. So from the two of you who are both experts in this, is it a mind or body issue? Because I've heard both. Being able to or have an orgasm. We're speaking about females mostly right now. And the studies show cannabis-infused lubricants all the way to ingestion via inhalation, smoking, THC. And so you see everything in between, from suppositories to bath bombs for calm and relax the body, et cetera. And so what are your thoughts on this? Is this a lot more of a marketing ploy, or do you see the vaginal lubricants, creams, as well as ingestion or inhalation, I should say, are what men and female are using?
I think it's a really interesting question you started with, and it sort of leads right into the second question, which is it mind or body? And in medicine, the answer is rarely one or the other. It's usually some combination of all of the above. But I think that in general, it's more of a mind thing that may then be manifest through physical symptoms or outcomes. And as a result, sort of getting onto your second question, it seems that most of these topical things, the lubricants, et cetera, are either not effective or they're minimally effective. And most of their effectiveness probably comes from the lubricant rather than from the cannabinoids. Whereas giving it systemically through inhalation, though I wouldn't necessarily suggest smoking per se, addresses these sort of broader psychological impediments, and then sort of allows not only a better emotional and cognitive state, but then the manifestation of that through the body then becomes more conducive to a positive sexual experience. Suzanne, do you have something to add?
Yeah, and to add to that, I think when we talk about THC and the default mode network and the, very much so the executive functioning of the brain and the prefrontal cortex, where, many women talked about in the study. And I mean, I'll just add, I had this problem for 30 years and saw 4 sex therapists. And it was cannabis that actually so inspired me and gave me my access to my orgasm that I literally sold my company and went back to school for my PhD. I mean, that's how dramatic, how much of an impact orgasm and the importance of orgasm can have in one's life, that I made a dramatic life change. At 59 years old, I went back to school. So what I want to say too about this prefrontal cortex, and being one who, from in the research and also personally, how it quiets the thoughts, and it allows a woman to actually be in her body and feel the sensations that are going on in the body, and shut down the, am I taking too long? Do I have an odor? I mean, all the thoughts that go on in a woman's mind, even during sex, can be quieted down with a little inhalation, you know, and knowing the right amount. And that's something we can talk about. That is very, very important.
And I think it, you know, in our past conversations, you have also pointed out that it's not as simple as, you know, you're taking a medicine and bingo, it works. It's more that the medicine allows you to be in the moment and allows you to feel the feelings and in essence almost sort of shows you or allows you to get back to a place where you can have that orgasm. And so that the medicine itself is very helpful, but then there's sort of still this learning or relearning process. And that I think is important because we want women who might be listening to this or clinicians who might be listening to this to understand that the medicine is a facilitator, if you will, but ultimately there's still some psychological work for the woman to do to actually make use of the facility that the cannabis gives her so that she can then have this orgasm.
No, I wanted to say that some women have orgasmed the first time they used it. I interviewed women. One, you know, and we can talk about in more detail later, just the stories of women, but, you know, this particular woman had told her partner, which is key, the communication. Instead of faking orgasm, you know, she said, listen, I was raped as a teenager. I've never been able to orgasm at all from anything. And he said, try this. And he gave her a hit of cannabis. She orgasmed the first time. So some people will be able to do that, but the cannabis actually gives us access to our own psychologists in a sense, you know, at least this has been my experience to use it this way, kind of the way you were explaining it, Jordan, you know, to say, is there anything that's blocking me? You know, so when we talk about inviting, because I couldn't surrender, you know, like I had a really hard time learning how to surrender to this cannabis thing, like learning how to surrender to the high, because I was so used to, I raised a couple kids by myself. You know, the masculine in me, you know, was very strong. And it's like, what? We're gonna do what? Like, we're gonna surrender? Are you kidding? So I had to work with my mind, and it was a job. You know, you have to be dedicated to it. It's definitely it requires dedication.
I'm finding two things. One, when you have a cannabis-infused product with THC, and you made mention at the beginning, the important is making sure you have the right amount. Too much could bring the opposite effect. Too little, you're there. So finding that sweet spot, and I think that's with anything when you're using cannabis, find that sweet spot. More is not always better. I would look at less is more. But a lot of the women that I've spoken to have used cannabis to heighten their sensations. But then there's also the group of women that are doing it for pain relief and not enjoying sexual intercourse because it's painful. And they're finding success with cannabis for that. And it's with that, those are the women that I've spoken to are using more of a lubricant or a suppository, a salve to put insertion. Right?
From a research point of view, that's a little complicated, right? Because if you're putting something down there, the fact that it's got lubricant properties in and of itself having nothing to do with the cannabis, that confounds some of the outcome research. There's also, you're taking time, right? Which means you're sort of focusing on being, pardon the expression, open to sexual congress. There's also some manual manipulation, right? Which may, you know, so it becomes difficult to tease apart which aspect of this process are leading to the benefit. And, you know, there's some fairly good evidence that applying cannabinoids and THC specifically doesn't lead to a lot of absorption or reaction. So it may be that it's less the cannabis and more sort of that process. But in any case, I think, you know, the idea that cannabis, when used for sexuality, can address a wide array of fundamental issues, including dyspareunia or pain with sex. I think it's sort of a no-brainer. And then the other part of it is, of course, if you have dyspareunia, there's probably also some psychological reaction to that. I mean, it's a little bit chicken and egg. It's like, the psychology leads to the pain, and the pain leads to a change in psychology. And, using cannabis to sort of get in there and interrupt that nasty negative feedback cycle, that I think is extraordinarily helpful. I'm fond of saying that most of sexuality occurs between the ears, not between the legs. And so that in most cases, intervening systemically is more effective than locally.
I think that's with a lot of things. A lot of the things that mess us up as humans is in between the two ears.
Oh yeah, the
And that's,
brain is a tremendous
oh boy,
organ for creativity and positivity and screwing us all up. So
oh boy, oh boy. Um, uh, Suzanne, you mentioned earlier about inhalation and the right amount. Would you recommend, or can you talk about having your partner join in the inhalation as you spoke about earlier?
Well, I can just share from from personal experience and also from women that I interviewed. They would anything from one hit to sharing a joint was really what was expressed. And I mean, I also had women who would say, listen, I take my cannabis and my husband takes his Viagra. So there was I would call it like a confidence. These women that learned how to use cannabis to access their orgasm. And I will share with you, I think it's really important to know when we talked about this, the women who had this orgasm problem, the largest group of women almost never orgasm without cannabis, while they almost always orgasm with it. And I mean, that was just a shocking, like it was so obvious to me that, oh my God. And the women who don't have a problem, orgasm with or without it. They just orgasm more frequently.
Are
But
you seeing that in different of age groups?
that's a good question. I did not dichotomize the ages, but we could, I mean, I have the data. I could go back and look at that.
Yeah,
That's a really good question.
yeah.
Most of them were 30 to 45 in my study, in our study.
What about um, cannabis massage oil? Leading in to that. Do you recommend that, or you just recommend like foreplay?
I mean, I'm going to recommend what the research is showing, and the research is showing that most women are using inhalation, and that's really across the board.
Yeah,
In our study, in Becky Lynn's study, in Alex Kasman's study, and Amanda Moser's study. Those are 4 recent studies that were done that inhalation is like the number one way that it's being used. So, I mean, there were some people using edibles. I mean, I think 30% in Moser's study, you were using edibles. Personally, they're not my thing.
maybe
But
I can jump in here and sort of talk about the clinical protocol here for when I treat patients with these issues. Because you kind of touched on a whole bunch of them. And I think, so we've talked about dose, how dose is really important, and that less is more, as with most medications. And that unfortunately in the cannabis world, there's often not a lot of focus on that. But in this case, for both males and females, focusing on doses is really important because, as you pointed out earlier, John, if we overuse this stuff, we can get a negative reaction. And that's particularly true in males who may, in fact, lose their erection, but it's true for everybody, within some bounds. I don't generally recommend that people smoke because smoke isn't very good for you. I generally do recommend a flower vaporizer because these things are designed in a way that we can prevent combustion while inhaling the medication aspect. And that, what we teach women is how to inhale, how to measure the dose. Inhalation has the advantage of being really rapid in onset so that it is more titratable and more useful when spontaneous sexual interest comes along. Whereas, of course, edibles take a good long time to kick in, and then it's not so clear whether all the partners would be sort of on the same page at the same time. The other thing that's really, really important is that we teach women not to use this for the first time with their partner, but rather to use it a few times solo and masturbate so that they get used to the process of inhalation, the sensations of what cannabis will do to them in terms of their head as well as their sexual experience, and sort of only after they're feeling confident about that to bring in their partner. It's also really important to address issues of consent, particularly if you are, in a relationship where things are not necessarily kind of buttoned down on that topic. Cannabis is interesting. It is an intoxicant, and certainly the case can be made that consent given after intoxication is not clearly consent. And so, and people can argue with that too, but to be on the safe side of things, the best approach, of course, is to have a discussion about sexual boundaries. And this is not just specific to cannabis use, but sort of all sorts of things, before it's the heat of the moment. And so we think that that's a really important part of the equation that we need to teach women who are going to be using this to bring it up with their partners and have a honest and hopefully fruitful conversation about that.
Yeah, and I'm glad, because I was just going to ask you that, and that was my chuckle and nothing else, because it is a topic that does come up of consent, consent, consent. And so, can you add to that, Suzanne?
Yeah, I mean, what comes to mind to me is a woman I interviewed who was using cannabis in hookups, and realizing that that was probably not a good idea for her, like that she really needed to have the meetings before with her potential partner, to a sex partner. So yeah, I mean, it totally puts someone in an altered state of consciousness. So, kind of knowing who you're going to be having sex with is and feeling safe, like that issue of safety is absolutely critical. And it's a critical not only for the sexual experience, but I mean, to allow an orgasm to happen, woman has to feel safe.
Well, in particular, for many of the patients, as you mentioned earlier, whose source of lack of orgasm comes from some sort of sexual trauma, but it is certainly important that they are in a safe and safe environment, safe relationship, even if it's a hookup, but they just have done enough of the vetting that they don't feel like they're in danger, because then they're not going to have that orgasm anyway,
Right.
regardless of the cannabis, right? So it isn't simply like Viagra, where you take the pill, you get the erection. This is you take the medicine, and in the right circumstances, with the right mindset, which the medicine helps achieve, then you'll be able, hopefully, to have the kind of satisfying sexual.
And can we talk about that sexual abuse for just 1 second? Because that women who have had a history of sexual abuse or sexual trauma, including childhood sexual abuse, orgasm difficulty is the #1 sexual complaint of women who that's out of research of women who have orgasm difficulty. So, and that came up quite a bit in the research in our results. It also came up that women who had sexual abuse histories and mental health diagnoses, it was statistically significant that cannabis improved orgasm. So that was also pretty fascinating, some pretty good findings there.
Yep. There's another thing that we've kind of been touching on tangentially that I think I want to bring up, which is, as John had mentioned earlier, cannabis is stigmatized and taboo. That's, I hope, getting a little better. Sexuality is certainly taboo and stigmatized. And so we're really talking about the intersection of two kind of difficult topics. And as a result, a lot of women are not getting the treatment that we can offer them. And those who are often sort of doing it yourself, right? And I think that that's problematic too, because like any medicine, cannabis has best practices, it has risks, and guidance can sort of get us to the finish line more safely and more quickly. So I would make the case to the clinicians who are listening to this that we need to have an open mind, and we need to be listening to our female patients and seeing if we detect issues around sexuality so that we can volunteer this as a treatment. And to the women or women's partners or allies who are listening, I think we need to be aware that you don't have to go it alone. And it may be fairly few clinicians at the moment who have this knowledge, but that's what I and Suzanne and the association are working to increase. And that if you go looking for help and guidance, you will find it, and you will also encourage more clinicians to focus on it. So I wouldn't recommend the DIY approach. I think that there's a lot for my female patients to gain by the discussion and the advice that I and other clinicians might be able to offer them. And it's certainly, I think, worth it to seek out trained, knowledgeable, and caring clinicians to help make this go smoothly.
But ask questions. This is your body, your life. And do not be afraid to ask questions. And if your doctor does not know, ask for a referral, because there are many specialists like Dr. Tishler as well as Dr. Mulvehill who specialize in this. And I cut you off on your final words as well.
Thank you. No, just to say that, Jordan's a specialist in dosage. And I mean, I can help on the orgasm side with women, and I really find that knowing how much to take, I can't stress that enough. I referred someone to you this week because the first time she went and bought it and she took too much, and the second time she used it, she didn't take enough, and now she went to the store and buying edibles. I'm like, how many times is it going to take until you call him? Like you can work with an expert, seriously, especially on the dosage. It's critical.
Well said. Well said. Well, Dr. Jordan Tishler, always a pleasure. Dr. Suzanne Mulvehill, very nice to meet you as well.
Likewise. Thank you, John.
I'm your host, John Malanca with the Association of Cannabinoid Specialists, and we'll see you on our next casual conversation.
Children need your help. Older folks need your help too. Whether it's brain-destroying seizures or life-crippling pain, cannabinoid medications can be a game changer. At the Association of Cannabinoid Specialists, we are on a mission to train healthcare providers using research-backed science and to advocate for delivery systems that better serve patient care. Our children need us, and our parents do too. Help ACS bring care and relief to all who need it. Donate to ACS today.